Bismillah ar-Rahman ar-Rahim. Hello, all my colleagues and my friends and my fans. Let me talk about an important clinical issue, which is tetany. And what is the difference between tetany on one side and tetanus on the other side? Because these are two different clinical conditions or disorders. Tetany is a descriptive term of involuntary muscular contractions involving the distal muscles of the upper and lower limbs and overly stimulated also peripheral nerves, leading to peripheral neurological manifestations. So it is involuntary muscular contractions involving distal muscles with overly stimulated peripheral nerves and sort of abnormal sensations in the distal parts of the limbs. And so this is tetany on one side, but tetanus is totally different. Tetanus is an infectious disease, which is acute infectious disease, serious and in many cases fatal disease, life-threatening, especially if attended with serious complications, and the disease is caused by a toxin produced by an organism called Clostridium tetani, and this Clostridium tetani is a bacillus secreting an X-toxin called the tetanospasmin or the tetanus toxin, which is a neurotoxin. So this is tetanus, an acute infectious disease which is toxin mediated, and it affects the nervous system with fatal complications in many cases. And of course we all know that it must be vaccinated. It is one of the vaccine preventable diseases for those taking the tetanus vaccine during their pediatric age or during their pediatric phase of life. During childhood. It's one of the basic vaccines given to children early in life, the tetanus vaccine. So this is tetanus. Let me go back again to tetany. Speaking about tetany, it is rather a medical condition which may be in many cases acute medical condition, deserving acute medical attention by the health carers. And it is simply involuntary contraction involving the skeletal muscles of the hands and feet and the face, and causing painful spasms of the muscles of the hands and feet. There is what we call the carpal spasm in the hands and the pedal spasm in the feet. And the carpopedal spasm in the hand, it is extension of the interphalangeal joints, with flexion and abduction of the metacarpophalangeal joints and sometimes the carpometacarpal joint as well. And this may be painful and long-lasting if not properly and quickly managed. And this is usually associated with circumoral numbness and tingling, that is abnormal sensations around the mouth, which may later also spread to the limbs or the distal parts of the limbs, the upper limbs and the lower limbs, in the forearms and hands in the upper limbs, and in the legs and feet in the lower limbs. There is tingling and numbness. So this is classically carpopedal spasm, involuntary muscular contractions causing painful spasms of these distal muscles of the hands and feet, and usually starts with paresthesia or numbness and tingling around the mouth in the face. And then the contraction of the muscle start to appear in both hands and feet, producing carpopedal spasm. And there are two types of tetany clinically. We have what we call clinical manifest tetany, and we have what we call latent tetany, which is not yet manifest clinically. In the manifest tetany, we have clear manifestations and clear symptoms of perioral numbness and tingling and carpopedal spasm and abnormal sensations in the limbs. While in the latent tetany, this needs a provocation by certain clinical tests, including what we call the Trousseau sign, which is put forward by and discovered by Armand Trousseau, and this is by blocking the brachial artery. You can induce the carpal spasm by raising the blood pressure above the systolic and leaving it for 2 to 3 minutes. There will be a spasm of the carpal muscles and the classic carpal spasm in the hands, which I described, the extension of the interphalangeal and the flexion with adduction of the metacarbophalangeal joints of the hands. And the other sign is Chauvistic sign, which is by tapping the in front of the tragus of the ear on the exit of the facial nerve in the face. There will be flickers of or contractions of the muscles around the nose and the angle of the mouth on the same side. This is Chauvistic sign. So it has Chauvistic sign and Trousseau sign. These are the signs which clinical signs, which we use to reveal what we call latent tetany in clinical practice. Whether it is manifest tetany or latent tetany with the classic manifestations of carbopetal spasm and tingling and numbness, what are the causes? The causes is one of 4 things. It is either hypocalcemia, which is the commonest, the classic cause of tetany, hypocalcemia, that is low ionized serum calcium, and most common example, of course, is the hypoparathyroidism. Hypoparathyroidism, which is, and we all know that the parathyroid secretes an important hormone, which is the parathyroid hormone or the parathormone, which plays an important role in calcium and bone metabolism and phosphate metabolism. So lowering of the serum calcium, most commonly due to hypoparathyroidism, by any mechanism, by destruction of the parathyroids, by removal of the parathyroids, most commonly with thyroid surgery, when we remove the thyroid gland, accidentally removing the parathyroid, so the patient develops a post-operative, of course, hypocalcemia and tetany after thyroid surgery due to accidental removal of the parathyroid gland. Or there is a parathyroid destruction by tumors or by autoimmune process, like what happens in autoimmune parathyroid disease with hypoparathyroidism, or by any pathology which destroys the parathyroid gland producing hypoparathyroidism, autoimmune or non-autoimmune, or by accidental surgical removal or whatever causes absence of the parathyroid tissue. So hypoparathyroidism and hypocalcemia as a consequence of hyperthyroidism. Also, all other cause of hypocalcemia might cause, of course, the tetany. Also, rise of serum phosphate and disturbance of the phosphate to calcium ratio. In some cases, they may be responsible for tetany. So, lowering of calcium in many cases, and in some reported cases, rise of serum phosphate has even in some reported cases was reported and was found to be responsible for some cases of tetany in clinical practice. So disturbance in phosphate also. Another cause is the hypomagnesemia also, hypomagnesemia, that is lowering of serum magnesium. Number 3, hypokalemia, all conditions associated with hypokalemia, that is lowering of the serum potassium, and most commonly whether drug induced or due to gastrointestinal or renal loss, or in patients with alkalosis. There might be hypokalemia. So hypokalemia of whatever etiology is also another cause for tetany. Number 4 is alkalosis in general. Alkalosis, as most commonly happens in patients with hyperventilation, like in anxiety, neurosis, panic, hysterical hyperventilation, neurogenic hyperventilation, peripheral hyperventilation, or hyperventilation due to systemic causes. Any cause of hyperventilation and deep breathing and rapid deep breathing, it might also cause wash the CO2 with hypocarbia and cause tetany. So the alkalosis is another cause, generally alkalosis, due to most commonly hyperventilation syndrome. It might also cause or be the cause of tetany. So hypocalcemia, hypomagnesemia, hypokalemia, and alkalosis are the underlying causes of tetany in clinical practice. The most severe form of tetany usually occurs in patients with Graves' disease, with vitamin D deficiency and high alkaline phosphatase, as a post-operative phenomena or as a post-operative complication. And this is the most severe form of tetany. And also tetany following thyroid surgery in general with accidental removal of the parathyroid glands is another common clinical setting of tetany, in addition to the tetany due to other causes which I just mentioned, which are electrolyte disturbances, hypocalcemia, hypokalemia, hypomagnesemia, and the alkalosis. The treatment of tetany is by treatment of the underlying cause, by correction of the electrolyte disturbance. If there is hypocalcemia, we have to give the patient intravenous calcium chloride or calcium gluconate, 10 milliliter bush, and then we might maintain with infusion by calcium with saline or calcium with dextrose, and then maintain the infusion according to the severity of hypocalcemia in the individual case, because this varies from patient to patient depending on the underlying cause, the duration, and the severity of hypocalcemia. In patients with hypomagnesemia, we have to give them magnesium injection. In patients with hypokalemia, we have to replace the lost potassium and to correct the underlying cause of potassium. In patients with alkalosis, we have to correct the alkalosis, whether it is that's the high pH, the arterial pH, we have to correct it to the normal. So treatment of alkalosis, whether it is respiratory alkalosis or metabolic alkalosis, we have to correct it in order to correct the tetany. So it's in many cases an acute medical condition which deserves an acute medical attention, but if it is a milder and chronic condition, it deserves also healthcare provider consultation by the patient in order to detect the underlying cause and manage and prevent any acute deterioration of the case, which might be even associated with increasing morbidity, although it's rarely associated with increased mortality or life-threatening, rarely to be so. This is as regards tetany in clinical practice. In short, what is tetany? Then I will move to talk about tetanus. Tetanus, on the other hand, is, as I mentioned, is an acute bacterial infection which is toxin mediated. The bacteria is Clostridium tetani, which enters the body through contaminated wounds or injuries in the form of spores, and then these spores is present in the soil and in the dust. If the wound is contaminated by being outdoors, that's why we have to give any patient injured outside the tetanus toxoid and refer him to the ER or to the nearest hospital to give him tetanus toxoid because of the possibility of developing tetanus due to contamination of the wound by dust or dirt containing spores of the Clostridium tetani. And when the wound or the injury is contaminated, these spores inside the body will transform into the bacterium, and the bacterium will be active and secrete its exotoxin, which binds to the nervous tissue. It is a specific neurologic infection which is toxin mediated. Here the organism does not directly affect the nervous tissue as what happens, for example, in rabies by rabies virus or meningitis by meningococcus. Here it is toxin mediated by the exotoxin. This exotoxin has high affinity to bind to the neuromuscular receptor complex at the neuromuscular junction, and this toxin is taken up by the terminals of the lower motor neuron, and then they spread axonally to the spinal cord and to the brainstem, and then synaptically they spread to other neurons in the nervous system, and they cause what we call disinhibition. They cause what we call disinhibition of the lower motor neuron. So the biological or the pathobiological mechanism of the clinical manifestations, which is diffuse muscle spasms, in the classic common clinical manifestation, which is the diffuse muscle spasm affecting the body or the whole body. The classical or the underlying mechanism is what we call disinhibition of the lower motor neuron, preventing signals passing from the spinal cord to the skeletal muscles and causing the generalized rigidity and the spasmodic contraction with stiffness of the muscles of the body, which is the main clinical manifestation of tetanus. Tetanus has 4 clinical types. There is generalized tetanus, neonatal tetanus, localized tetanus, and cerebral tetanus. The most common form clinically is generalized tetanus, which is encountered in about 80 to 85% of patients with tetanus. It is most commonly generalized. It starts usually in the jaw, causing what we call lockjaw, and in the neck, causing the swallowing of problems or difficulty in swallowing, and then it spreads from the jaw muscles and the classic lock jaw, and also the green spasm due to spasm of the facial muscles, and from the neck with difficulty in swallowing spreads to the other muscles of the body with generalized rigidity and generalized muscle spasms, causing a stiffness of the abdominal muscles, stiffness of the back muscles, stiffness of the facial muscles, stiffness of the peripheral muscles of the body. And these spasms may be painful spasmodic contractions, which put the patient in severe pain and irritability. Also, this is generalized, and this is the classic picture of generalized tetanus, which is the most common clinical form of tetanus in clinical practice. Tetanus might have complications which include a spasm of the vocal cords, and is a possible complication with loss of voice, a spasm of the vocal cords. Also, a spasm of the muscles of the chest wall and the throat if the contaminated wound is in the chest wall or in the neck. So this will affect breathing, and this will be a big problem and causing breathing difficulties. Another complication, possible complication, is pneumonia. Also might happen in patients due to aspiration most commonly. So pneumonia is a complication, potential complication in tetanus, lower respiratory tract infection, and most commonly due to aspiration. Also, there might be pulmonary embolism in rare cases. There might also be complications related to autonomic dysfunction with high blood pressure and the variability in the heart rate, bradyarrhythmias, tachyarrhythmias, and this is most probably due to involvement of the vital centers in the brainstem if the toxin spreads to the brainstem, and especially in patients with cephalic and cerebral tetanus. So these are all possible complications. The patient usually dies as a result of the complications, not from the disease, but from the complications. And the treatment of tetanus, number one, the most important is prevention by giving the vaccine early in life. And if the condition, and by giving tetanus toxoid in exposed patients with contaminated wounds in outdoors, also in the streets or in any place, they have been injured, they have been contaminated by dust or soil, we have to give tetanus toxoid in order to prevent the fatal complications of tetanus and to decrease the mortality rate in such patients. So treatment is the treatment of symptoms and putting the symptoms under control, muscle relaxants, analgesics, prevention of complications, and expectant treatment of complications, to be active, not reactive in your clinical approach to such cases. Of course, in many cases you have to put them in the ICU to monitor the hemodynamics, to monitor changes in blood pressure and in pulse. and to put them on symptomatic and expectant treatment for possible complications of tetanus. But there is no cure for the tetanus itself, no cure for the tetanus itself, and the management is the management of symptoms, that is symptomatic treatment and expectant treatment of possible complications in such condition. The tetanus cannot be transmitted from person to person, although it is vaccine preventable disease, cannot be transmitted from person to person, and we should pay attention to it. And in many cases, if not giving the toxoid, we can give anti-tetanus immunoglobulin for rapid acquired passive immunity against the toxin, and to bind the toxin quickly and prevent its spread to the nervous tissue, which might be irreversible and fatal. So the tetanus toxoid, anti-toxin immunoglobulin are also possible treatments in some centers, which are equipped with such immunoglobulin, and also by the other modes of treatment, better to be treated in the ICU. Tetanus is a fatal, serious disease if not properly managed. This is the difference between tetany and tetanus. Thank you so much, and I will see you in my next presentation.